fibromyalgia is one of what's called the chronic overlapping syndromes, or chronic widespread pain syndromes. And so fibromyalgia, of course, you tend to get a range of different symptoms with it, from tender points and trigger points all around the body. You often will find that there's psychological elements such as anxiety. Sometimes, anxiety tends to be an early stage, and across time that can lead to depression because of the sort of sense of hopelessness. Often there's breathing pattern disorders and issues related to that, which is often driven by the stress of fibromyalgia or stress from outside of that situation. There's often food sensitivities. And so the interesting thing about fibromyalgia is that, as I say, it's one of these chronic overlapping pain syndromes, and they all tie in with central sensitivity or central sensitization. And so you've got chronic fatigue syndrome is another one. Irritable bowel syndrome is another one. You've got recurrent, what's it called? Interstitial cystitis. Yeah. You've got premenstrual syndrome and dysmenorrhea. So that's painful periods. You've got restless leg syndrome. You've got temporomandibular joint dysfunction, migraine, tension type headaches, and really the list of these overlapping syndromes, those are just ones I can remember off the top of my head. But they are expanding. Oh, actually, two others that are worth mentioning is multiple chemical sensitivities. So that's where people finding that they're reacting to everything they put on their skin, or that they're eating or cleaning with, or spraying in the air, and they kind of feel terrible when they use the polish to clean the glass or whatever. Not being able to tolerate the smell of petrol fumes, those kinds of things. These are multiple chemical sensitivities, but also post-traumatic stress disorder. Okay, so PTSD is another thing that contributes to each of these syndromes. And so the thing about each of those things I've listed, and there's many more beyond that, is that when you've had one, such as fibromyalgia, you're more likely to have another, such as multiple chemical sensitivities. And if you've got multiple chemical sensitivities in fibromyalgia, you're likely to have painful periods if you're a woman. Or you could
that's debatable these days.
It's debatable these days. Or irritable bowel syndrome, whatever it is, tension type headaches. So the point is that one seems to open the door to the next. And why is that? Well, it's because first of all, there's central sensitization. So you're going to start getting dysfunction in the way the central nervous system is perceiving what's going on. But also, they all relate back to allostatic load or physiological load. So they all relate back to too much stress on the organ and glandular systems in the body. And so the solution to these things isn't to just cut out a certain food, which some people say, oh, it's all about gluten or whatever. And then, but gluten may be a factor, but it's not all about gluten. It's all about stress at work. It's like, no, that could be a factor, but there's multiple contributing factors to these things. And one of the things that links them together is a breathing pattern disorder, right? And so what we know about breathing pattern disorders is that they are very, very closely associated with anxiety, or other, emotions that are perturbing, but so anxiety probably encapsulates those emotions the best. But if you're anxious, your breathing rate goes up. Okay. And then when your breathing rate goes up, what tends to happen is you get a series of other physiological effects. So essentially you're going into a fight-flight state. And so what that does is it shuts down digestion, because you can't be in fight, flight, and rest and digest at the same time. So if you're in fight, flight, your digestion shut down. So next thing is the person starts getting a bit of irritable bowel, or they get a bit bloating, or they get some discomfort in their stomach, or some GERD, some gastroesophageal reflux, right? And so an element of that is that when you've got these breathing pattern disorders, one of the things that leads to development of tender points and trigger points around the body. And without going too deep into the physiology of it, essentially what is going on there is you're starting to recruit the outer muscles, so the muscles that are more anaerobic in their function. They don't use oxygen to generate power. The deep intrinsic muscles in the body that stabilize the body, they are what we call tonic, and they're aerobic. And so that means that when you're breathing normally, they're getting fed perfectly. There's no problem there. When you stop getting the oxygen into the system that you need, or the other way around, you're breathing off too much carbon dioxide, that can pose a problem for those muscles. But also, central sensitization tends to inhibit the tonic drives to the tonic muscles. So those muscles that actually stabilize your spine or stabilize your knee or your ankle or your shoulder. So what you get is you get a whole body picture where actually you're becoming less and less stable. Okay, so hypermobility is part of these patterns as well. You often hear people with persistent pain saying, "Oh, I've been diagnosed with Ehlers-Danlos syndrome or EDS." And it's like, well, that's a hypermobility issue. Have you really got EDS? Now, some people will have EDS, and that can certainly be a factor in persistent pain. But actually, most people with persistent pain can't stabilize because their tonic system shut down from central sensitization. So now what you've got is now, what says they can't stabilize. They can stabilize, but only using their outer muscles. So their outer unit muscles are what we call their phasic muscles, which, as I mentioned, they're anaerobic. So what does that mean? Well, it means you can stabilize, but you're going to get fatigued really quickly. Okay, so you'll be able to stand up straight and you'll be able to go for a walk. But after 20 minutes, half an hour, you're going to be like, I need to rest. I'm exhausted. Why is that? Because you're using your fast twitch fibers, your anaerobic fibers, to move you and to stabilize you. So it's not, it's not just normally your slow twitch fibers, your deep tonic fibers tend to stabilize when you're standing around or sitting in a chair. And then when you get up to move, they still stabilize, but now your fast twitch fibers work over the top of them and move you along. But with a situation where there's central sensitization, what you're getting an inhibition of those deep intrinsic fibers, the tonic fibers. So now you're using your fast twitch fibers just to sit down, just to stand up. But then if you want to go for a walk to the shops, well, now you're asking a hell of a lot of them because they've got to stabilize and mobilize you. They've got to move you, into the shopping mall or whatever. So how do these fibers work? Well, they're anaerobic, which means that they produce a lot of lactic acid and pyruvate. So the end result of that, we all know what lactic acid feels like because we've walked up a hill or we've done some sprint drills or we've played a sport or whatever it might be, done some weights. That's where the muscle starts to feel tired. It starts to feel achy. It starts to tighten up and it eventually gets to the point you can't move it anymore, right? That's the lactic acid and pyruvate building up in the muscle. And it hurts. And then there'll be delayed onset muscle soreness after that as well. So you end up with a situation where because people are using the outer unit muscles or the phasic muscles the whole time, they've got in a constant state of lactic acid and pyruvate production. That irritates the nerve endings. And then the nerve endings become sensitized and you end up with tender points and trigger points in the tissues. So really just from a breathing pattern disorder, all of that could be driven. But you've got to ask the question in the first instance, why have they got the breathing pattern disorder? And again, the research into this shows that they can't find a cause for breathing pattern disorders. They know anxiety contributes, they know a few other things contribute, but they can't find a single cause. And really what we need to be doing is starting to think holistically and say, well, what are the stressors on this person's body? Because whether it's a sore little toe or an inflamed bladder or an inflamed uterus or an inflamed prostate or an inflamed gut or a blocked gut or, whatever it might be, all of those things, they are going to contribute to that central sensitization, which is going to increase, to that allostatic load, to that physiological load, which is going to tip you more towards fight, flight, or away from rest and digest. And so what that's going to do is it's going to increase your breathing rate. And then because your breathing rate goes up, you feel a bit out of sorts, you feel a bit panicky, a bit anxious. That drives a worse breathing rate. You get caught in a vicious cycle. Right? So fibromyalgia is essentially what we just talked about. It's all of those things combined. And it really boils back down to physiological load or allostatic load.
Thanks for watching the Radical Health Rebel YouTube channel. If you enjoyed this video, please be sure to share with your friends and family or share via your social media. Hit the like button, subscribe to the channel, and hit the bell icon to receive notifications of new video clips from the podcast. And if you want to watch the full episode, completely ad-free, plus premium content, and join the Radical Health Rebel Patreon community, head on over to the Radical Health Rebel Patreon channel at www.patreon.com/Radical Health Rebel. Thanks again for watching.